Hi, this is George Alger. Welcome to today's segment of Our Ventura TV. Today we're going to be talking about Medicare for All in a Capitalist Society. And our guest expert is Paul Newman, who's been an insurance advisor in the health industry for many years. Welcome, Paul. And what was your inspiration for delving into this topic?
Hi, George. Thank you. Like I said, I've been an insurance advisor for nearly 40 years. I've been working with individuals and groups, large and small, employers. And I think I have a really good feel for what people are looking for in their health plan and the frustration that people suffer when it comes to their premiums and their copays and everything else that goes along with health insurance. And then in today's society of when you hit 65 and you go on to Medicare and now you have a decent health care plan that you can add to or change to an HMO type of plan, why not make that available for all legal residents of the United States?
Good. So let's just start off with a definition here for those who may not be familiar with it. But what is Medicare?
Medicare, when a person turns 65, you've been paying your Medicare taxes all this time while you've been working, and when you hit 65, you become eligible for Medicare. So for those providers, the majority of providers will accept Medicare as your insurance. When you're in the hospital, it will cover basically 100% of your bill when you're in the hospital, and outside of the hospital for doctor visits will cover 80%. Plus, you have the option to turn in your Medicare if you want to for an HMO type of plan. They call it Medicare Advantage. But let's say you wanted to go on to a Kaiser plan, you can turn that into Kaiser, or you turn that into Medicare and then become a member of Kaiser, and now all of your services are done at a Kaiser facility. But you don't have premiums because Medicare is actually paying your Kaiser premium for you.
Okay, very good. So what does this mean, Medicare for All in a Capitalist Society?
Well, as there's a lot of talk about Medicare for All, where people are saying everybody should be on the same plan and there should be no co-payments and no co-insurance or anything like that for everyone out there. But the fact is, there are going to be people that want an upgrade of coverage. There are going to be providers that want to provide a higher level of coverage than what the cost of Medicare can allow. So in a Medicare for All in a capitalist society, what happens is we can go ahead and devise a plan that would make it so that most people will be on their Medicare plan. They can switch it to a Kaiser or another HMO type of plan if they choose to, or they can keep their plan, maybe have a few co-payments along the way. But if they want to go see a doctor that is charging more, or they want to get into a hospital and they want a private room, they don't want to be in a room with somebody else, those facilities could charge more, and that person, or in the case of an employer could still provide a supplement to their coverage that would pay those differences to them. But we would give tax incentives to the providers to give them nonprofit status, to give them help with, say, student loans, things like that, to incentivize them to accept what Medicare says is allowable in their plan. The other side of it is, of course, prescription drugs. Within the Medicare system, you would be able to get virtually all generic drugs at no cost, but maybe still have a copay for some brand name drugs. But Medicare would be the loan system that's overseeing the cost of drugs. So hopefully we don't have things spiraling out of control like we do with insulin and other drugs that we've seen on the market, if we have a true watchdog looking over that system.
Okay, so it sounds like the idea basically allows more choices. Is that a good description?
Yes, definitely more choices than what other people are saying on the Medicare for All system that they're looking at now. There is actually a bill that's in Congress that isn't going to go anywhere, obviously, under the present administration. And as far as Joe Biden is concerned, he is not touting Medicare for All of any sort. But I think I wouldn't even call it a hybrid. It's still providing coverage for all legal residents. I think in my system, the fact that it allows for more freedom will allow for more people to get on board with the plan.
Good. So you've been talking to people about this for some time and you've gotten feedback. And you mentioned to me before the show, there's some people who are not enthusiastic about it. So what are the arguments that you hear about it?
Well, the arguments are always, I want to choose my doctor and I want to be able to go here and I want to be able to go there. When, in essence, under the current system, even through the Affordable Care Act, you're still lining the pockets of the insurance companies and insurance brokers to be able to provide that coverage. And if we could provide all of that coverage within that one system and set that base, so let's say a particular service is $100 under Medicare. I go to have that service, it's $100. But this provider over here says, you know what, I want to charge $150 for that service. You're going to know that up front because that provider will have a designation saying, I am a Medicare plus 50 provider. I can charge it as much as 50% more than what Medicare says is allowable for that service. But you know it up front, and perhaps you've purchased additional insurance to cover that. In the meantime, for most of us, we're going to go to the doctor that is already accepting it, or if we want to see that doctor for that additional amount, we come up with our $50 out of pocket. But in the long run, everybody still has access to coverage, and those that can't afford that additional coverage will still have at least as good a coverage as they would have on Medicaid, or in California, of course, it's Medi-Cal. But certainly would be a much better coverage than that at that point.
Good. Now, would there be a possibility with that model that some localities that may be more expensive, for instance, in California,
Right.
that maybe a majority of providers of a certain service would raise their rates? Is there a potential for that?
There's a potential for that, but Medicare, as Medicare is now, they do pay different rates based on the locations because they know costs are higher here and there and everywhere else. But certainly in Beverly Hills, you're probably going to find more providers that are going to charge more than are going to provide in Ventura or Camarillo or Oxnard or Bakersfield, whatever that might be. And certainly if you're out in rural Oklahoma or Arkansas, then perhaps the charges are going to be less as well. But Medicare will adjust for that. And then the ability to purchase that additional coverage, if you want to, is also available too. So then the other big argument, of course, is how are you going to pay for this? So right now, you have on your payroll, you're paying 3% of income, usually paid by your by you and your employer. What we would do is we would add an additional 3% that the employer would pay, and you think, oh my gosh, that's a big burden that we're putting on this employer. But remember, we're also taking away the burden of the health insurance premium that employer was paying to begin with. So I think once you look at that, and as I've kind of analyzed the numbers, 95% of the people are going to really be better off cost-wise. They're going to pay less money out of pocket for their services, for their premiums, for their co-pays. The upper 5% is definitely going to pay a little bit more in taxes, still offset by what they would be paying in premium for their services. But in the long run, the employer and the employee and the self-employed and the unemployed are really all going to end up better off, and nobody's going to be left uncovered. I mean, God forbid we end up in another COVID situation like this, which is likely to happen at some point in the future, where we have millions of people that are uninsured out there, not even, afraid to go into the emergency room with their conditions and really just spreading the disease further and further because they did not seek treatment. So if you can provide coverage for everybody, you can get something like this that we have now under wraps, under a different administration.
All right, very good. So, Paul, we're just about out of time here. I'm wondering if there's a way viewers can get in touch with you for more information, and if you have a summating message for the viewers.
Sure, I'd be happy to send a summary out to anybody if you just go ahead and email me at Paul at not that Paul Newman That's Paul at notthatpaulnewman.com. And I'd be more than happy to send you a Word document that gives you just 2 pages. It's not really all that long, but it pretty well lays out how this plan would work and why I feel it's superior to the plan that's currently in Congress and that really has no chance of passing whatsoever, even under the Biden administration. This is something I think we can go forward with.
All right. Well, thank you very much, Paul.
Thank you. Appreciate it, George.
This is George Alger signing off for this segment of Our Ventura TV. Until I meet again.